Erectile dysfunction, often referred to as ED, is a condition that affects a significant portion of the male population. It's more than just an occasional difficulty. It's a persistent issue that can have profound effects on a man's life. Affects millions of men worldwide, crossing all demographics and age groups, though it becomes more prevalent as men age, and is defined medically as the ongoing or recurrent inability to achieve or maintain an erection that is firm enough for satisfactory sexual intercourse. It's important to distinguish it from isolated incidents, which are often normal. Beyond the purely physical aspects, ED can deeply impact self-esteem, personal confidence, and intimate relationships, creating a ripple effect that touches many areas of a man's life, often leading to feelings of anxiety, symptoms of depression, and a tendency to avoid intimacy altogether, which can further strain relationships. The emotional toll is very real and should not be dismissed. And the pressure to perform sexually can create a vicious cycle where the fear of failure itself worsens the problem, leading to even more anxiety and difficulty. Open communication with partners may break down under the strain, turning what should be a source of pleasure and connection, intimacy, into a source of stress and potential conflict. It's absolutely crucial to understand that ED is, in the vast majority of cases, a treatable medical condition, and not a personal failing or reflection of one's worth. Thankfully, the conversation around men's sexual health and well-being is becoming increasingly more open and destigmatized, encouraging men to seek help. The introduction of Viagra in the late 1990s was a watershed moment, helped normalize ED as a common and treatable issue, paving the way for greater awareness and acceptance. Now, in 2025, we're seeing the next wave of innovation and advancement in treatment options, including new and innovative delivery methods that offer men more choice, greater convenience, and potentially improved outcomes. Today, we'll explore a novel formulation, a Viagra spray, specifically designed to address some of the limitations and drawbacks associated with traditional oral pills. This spray promises a faster onset of action and potentially fewer systemic side effects compared to pills, representing what could be a significant and welcome step forward in the field of men's sexual health. Understanding this development matters and is relevant for everyone, regardless of their personal experience with ED, as it reflects the ongoing and tireless efforts within the medical community to improve overall quality of life for men. So, let's dive into the science and explore how this new approach could potentially change the landscape for ED treatment and management. Erectile dysfunction affects millions of men worldwide, impacting their relationships and self-esteem. But now, there's a new option on the market designed to address these concerns with speed and discretion. Meet Hexane, a fast-acting oral spray containing sildenafil, the same active ingredient as Viagra. This well-known compound has been a cornerstone in ED treatment for years, offering a reliable solution for many men. The innovation isn't the drug itself, but rather the method of delivery. While traditional pills require digestion and absorption through the stomach, Hexane takes a different approach. It's all about how it's delivered, a metered dose spray absorbed directly through the mouth's lining. This is known as oromucosal absorption, and it allows the medication to enter the bloodstream much more rapidly. This oromucosal delivery means the medication can work in as little as 5 to 10 minutes, a significant improvement over traditional pills. Much faster than the pill, which can often take 30 minutes to an hour to take effect. For many, this speed restores spontaneity to intimacy, allowing for a more natural and less planned sexual experience, removing the need for advanced planning and the anxiety that can come with it. The spray is simple and discreet, making it easy to use in a variety of situations without drawing unwanted attention. Packaged like a breath freshener, so it can be carried without embarrassment or concern, and requires no water, adding to its convenience and ease of use. Its portability and ease of use reduce anxiety associated with ED treatment, and make treatment feel less clinical and more integrated into daily life. Hexane represents a shift in ED treatment, a move towards patient-centric solutions that prioritize convenience and discretion. Focusing on user experience as much as effectiveness, recognizing that the psychological aspects of ED are just as important as the physical ones. By prioritizing speed, allowing for more spontaneous and satisfying sexual encounters, convenience, and discretion, Hexane aims to remove some of the barriers that prevent men from seeking and adhering to ED treatment. It addresses real-world concerns for men with ED, offering a practical and accessible solution that fits into their lifestyles. This isn't just a new way to take an old drug. It's a reimagining of how ED medication can be integrated into a man's life. It's a new approach to managing a common condition, one that takes into account the emotional and psychological impact of ED. The spray's design helps men feel more in control of their sexual health and their intimate experiences, and less self-conscious about needing medication, fostering a more positive and confident self-image. It's a thoughtful evolution in the world of men's health, reflecting a growing understanding of the multifaceted nature of sexual well-being. Let's look at how this spray actually works, examining the science behind its rapid absorption and discreet delivery. The Hexane spray's rapid action comes from its unique absorption method. Unlike pills that must be digested, the spray delivers sildenafil directly into the mouth, where it's quickly absorbed into the bloodstream. This transmucosal route bypasses the stomach and liver, allowing effects to be felt in minutes. Once in the bloodstream, sildenafil works by relaxing blood vessels in the penis, increasing blood flow during sexual arousal. The spray doesn't cause an erection on its own. Sexual stimulation is still required. This method may also mean higher bioavailability, so a lower dose could be effective, potentially reducing side effects. By skipping the digestive system, the spray offers a faster, more efficient, and possibly gentler option. It's a smart update to a proven medication. Now, let's compare the spray to the classic pill. When we look at the differences between Hexane spray and Viagra pills, one key factor stands out: speed of action. We're talking about a potential wait time of just 5 to 10 minutes with the spray, versus up to an hour with the pill. This difference can be significant. This speed allows for spontaneity in intimate moments, making intimacy feel more natural, relaxed, and less like a scheduled event. It allows you to be in the moment, without the pressure of planning ahead. Another advantage is that the spray's absorption isn't affected by food intake. This is unlike the pill, where absorption and effectiveness can be significantly delayed or even reduced by a heavy meal. Discretion is another key advantage offered by the spray. The spray is easily portable, fitting discreetly into a pocket or bag, and it can be used quickly and easily without the need for water or any special preparation. For men who feel self-conscious or anxious about ED treatment, this level of discretion can significantly ease anxiety and promote confidence. Furthermore, the spray may also require a lower dose of medication to achieve the desired effect, potentially reducing the risk and severity of side effects. This is particularly relevant for side effects like headaches, facial flushing, or indigestion, which can sometimes be associated with higher doses of oral medications. Therefore, for those who are particularly sensitive to the pill or experience bothersome side effects, the spray offers a promising and well-tolerated alternative. Ultimately, the spray provides a greater degree of flexibility, convenience, and comfort in managing ED. It's about seamlessly integrating treatment into your everyday life, making it a natural and unobtrusive part of your routine rather than the other way around. So, with all these advantages, who exactly stands to benefit the most from this innovative new option? ED is more common than many think, affecting over half of men aged 40 to 70, and increasingly younger men too. 1 in 4 men seeking ED treatment are now under 40, showing it's an issue across ages and lifestyles. The Hexane spray appeals to a wide range: older men wanting spontaneity, younger men seeking discretion, and those with trouble swallowing pills. It's also ideal for men who experience stomach issues with pills or have medical conditions like dysphagia. Anyone eligible for sildenafil could consider the spray, depending on their needs and preferences. The choice between pill and spray is personal. Spontaneity, discretion, and side effects all play a role. Having options empowers men and their doctors to tailor treatment. Next, let's look at what causes ED and how it's usually treated. ED can stem from physical issues, like heart disease, diabetes, or nerve damage, or psychological factors such as stress, anxiety, or depression. Often, it's a mix of both, with relationship problems and poor communication adding to the challenge. Traditional treatment starts with lifestyle changes: better diet, exercise, quitting smoking, and reducing alcohol. Therapy can help address psychological causes. When these aren't enough, oral medications like sildenafil, tadalafil, and vardenafil are the standard. Other options include vacuum devices, penile injections, or in severe cases, implants. The Hexane spray now joins this landscape as a fast, less invasive alternative. It's especially useful for those who want a quicker, more discreet solution. The evolution of ED treatments reflects a broader shift toward patient-centered care. But how accessible is this new spray? Hexane spray has gained approval in several countries, starting with the UK, where it's prescription only. Availability varies by region, so patients should check with local health authorities or pharmacies. As a newer product, the spray is generally more expensive than generic sildenafil tablets. Insurance coverage and healthcare systems will affect the final cost to patients. For many, the benefits of speed and convenience may outweigh the higher price. Getting the spray requires a medical consultation to ensure safety and rule out contraindications. Online pharmacies and telehealth have made these consultations more accessible. The process is similar to getting a prescription for the pill. Now let's see what doctors and experts think about this innovation. Medical experts welcome the Hexane spray as a valuable addition to ED treatment. Its rapid onset is seen as a major benefit, restoring spontaneity and reducing stress for couples. The spray is especially helpful for men who can't swallow pills or who experience stomach side effects. Doctors appreciate having more ways to tailor treatment to individual needs. However, they caution that the active ingredient is still sildenafil, so the same safety rules apply. Men with certain heart conditions or on nitrate medications should not use it. A proper medical consultation is essential to ensure safety. Experts agree that innovations like this help destigmatize ED and encourage men to seek help. Ultimately, it's about improving quality of life and supporting men's health. The Hexane spray marks a smart evolution in ED treatment, faster, more discreet, and user-friendly. It gives men more choice, fitting treatment to their lifestyle and preferences. This patient-focused approach is the future of medicine, emphasizing convenience and emotional well-being. We'll likely see more innovations, like topical gels or dissolving films, designed for real-life needs. The conversation around Hexane is about more than one product. It's about supporting men's health and breaking down stigma. As treatments improve, more men will feel empowered to seek help. Science is making ED less isolating and more manageable. With better options, men can take control of their health and relationships. The future is about confidence, connection, and living life fully. That's a win for everyone.